diseases have been told by welfare assessors they could recover enough to go back to work. Disability campaigners have branded the assessment farcical and are calling for a rethink of the system. Sky's Fraser Maud has this report.
Like over 500,000 others in England, Sue Watson suffers from rheumatoid arthritis. On bad days, it can make even the smallest movement intensely painful. When she was forced to give up her work as an aromatherapist, her work capability assessment put her in the work-related activity group, or RAG. That meant even though her condition is degenerative, she was deemed able to recover to the point where she could look for work.
It has a detrimental effect because stress affects rheumatoid arthritis. And obviously the stress of being felt that you were on the scrap heap and not believed, and having to think, well, I'm going to be forced to back into work, even though I can't. That had a huge impact on me.
And Sue's not alone. Charities claim that 45% of people with progressive conditions like rheumatoid arthritis, Parkinson's, MS and cystic fibrosis were given similar assessments.
We believe that this is a fundamental problem with the tests that are being carried out. We think that the government needs to relook at these tests. There are much more appropriate groups for these people to go into, not into these groups that actually don't really suggest they understand the condition. We also feel that those people carrying out the tests don't understand what it's like to, say, have a condition such as Parkinson's.
The government say that there is strong evidence that getting back to work can be beneficial for many people with health conditions, and that it's ridiculous to suggest that they think people with degenerative conditions will recover. Atos Healthcare, the company which assesses individuals on behalf of the Department for Work and Pensions, say that their healthcare professionals are well trained in the assessment of chronic and progressive illnesses and realise that many people will sadly never show an improvement. However, they say the advice they're asked to give the DWP relates to how individuals are affected by their illnesses at the present time, not in the future. But despite reassurances from the government that they are aware of the issues faced by people like Sue, she and many others feel that a serious rethink is now needed on how the current system is working or not. Fraser Maud, Sky News, Leeds.
Let's get some reaction to this with Professor Alan Silman, Medical Director of Arthritis Research UK, which aims to get arthritis sufferers back into the workplace. Now, Professor Silman, Arthritis Research UK wasn't one of the charities that conducted this research, but what's your response to the figure that 45% of people with degenerative diseases were told that they would be able to go back to work?
Well, one of the things that people with arthritis want to do is they want to go back to work and they don't want to be out of the workplace. But there's a problem when you have a condition which varies day by day and it's unpredictable. And what they complain about and what we need is to have a system which brings together employers, healthcare professionals and the patients in a conversation to understand what they can do to stay in work, what they need to do when they don't feel like working, and what changes need to be made to allow them to work at the time when they can do it. And one of the things that's going to need is going to need training. It's going to need training of healthcare professionals to do the proper assessment. It's also going to need training of employers to understand the nature of conditions like arthritis, which vary, to allow their employees to go back to work when they can.
So how are assessments currently carried out? Are they face-to-face?
Well, interestingly, although most of the assessments are done face-to-face, a proportion are not. And one of the problems is, as highlighted in this report from the patient groups, is that assessments don't necessarily take account of the fact that these conditions do vary. People have varying needs, and if we could allow for those, then I think people could return to work in some way doing the job that they want to do.
What's the experience that you've had? Have you heard from arthritis sufferers who have had a detrimental effect through this assessment and it's impacted on them and their work life?
Well, absolutely, and not only does that affect detrimentally, but also worries about work and worries about coming out of the workplace because of the financial loss, the psychological loss, the loss of status and what have you. So one of the things that the Arthritis Research UK is doing is investing in a programme which is called vocational rehabilitation. What we want to do is to try and teach patients, teach employers what's needed in terms of their specific disease to understand what's needed to get them back to work. And I think if we can succeed in that, there's a real prize to be obtained.
And also it's an important message not to write people off just because they have these degenerative conditions. In a lot of cases, it can improve their condition.
Absolutely, and one of the sad statistics is that often people get written off very early in their condition before the modern treatments have had a chance to kick in. Giving people a chance to have access to the treatment, allow the treatment to work, give them exercises and rehabilitation, and then they can get back into the workplace, and don't write people off too soon.
OK, Professor Alan Silman from Arthritis Research UK, thank you.
Thank you.
As the clouds roll in.